Good evening. I'm Dr. Jacob Thomas, and I'm an MD physician and a DNB physician. And I've been treating many COVID patients through this pandemic phase, through the first phase, and now in this second phase also.
I'm Dr. Monica Jacob. I'm MD and aesthetic physician, and we will be busting some myths about vaccination. So, what is vaccine and why do we need a vaccination?
So, if any virus enters our body produces a very strong antibody response against this virus. Basically, the WBC or the white blood cells has got what is called B cells and T cells. The B cells produces antibodies, and it also develops a memory about this virus. And the T cells also develops a memory about this virus, so that in future, if unfortunately the virus enters the body again, the body is able to mount a good antibody response against this virus, and this basically can prevent, or even if it does not prevent an infection, it will curtail or it will minimize the effects of the infection. So that is what a vaccine is about, and that is why we need vaccination, so that we do not get a severe disease and the mortality and morbidity will come down drastically.
Okay, now we have various options regarding vaccine. We have Covaxin, we have Covishield, we have Sputnik. Which one should we take? Which has a better protection and why?
So, in an emergency approval of Covishield and Covaxin was given in India, and the Sputnik vaccine is what was, made in Russia, but some clinical trials were done in India also. So the Sputnik virus and the Covishield virus is what is called a DNA-based virus vaccine, or it is a vector-based vaccine, which uses the Sputnik vaccine uses the human adenovirus and puts the gene of the COVID virus inside that. And the AstraZeneca or the Covishield vaccine uses the chimpanzee adenovirus and the gene which introduces the neutralizing antibodies of the COVID virus is put into this AstraZeneca or Covishield vaccine. And the Covaxin is deactivated or inactivated coronavirus with some additives, and that is the vaccine. And that is why all three has gone through proper clinical trial phases, and it has proved to have a good safety profile and very, very reasonable efficacy also. So my thing or advice would be that if you get any of these vaccines, the Covishield, the Covaxin or Sputnik virus, all are almost equally good, and the safety profile of all are good. The efficacy may be some notches above or below, but you can take any of these vaccines. They are all equally good.
Okay, so how many vaccinations are we supposed to do? And after these two doses, which are advisable right now, after how long do we get the protection from the virus?
Okay, so all these vaccines have been done, the trials have been done at day 1 and then after 1 month, that is day 28. So the Sputnik, the Covishield and the Covaxin, they have all been studied as double doses, the first one on day 1 and the second after 1 month. Now, so after the first dose, the antibody response that the human body develops is not that robust. And after the second dose, about 15 to 20 days after the second dose, we get a very good and robust antibody response. So actually, after the first dose, the protection may not be that much. And about 15 to 20 days after the second dose of any of these vaccines, the body gets a very good antibody response. So the real protection actually starts about 15 to 20 days after the second dose. And therefore, somebody who's taken a vaccine, both the vaccine and about 15 to 20 days after that, they get some 70 to 80% or maybe a little more than that protection. But mind you, it may not prevent the infection in many cases, but it curtails, or it becomes, the severity of infection becomes much, much less if you have taken both vaccine and you have crossed the period of about 15 days post that. So let's say around 45 to 50 days post the first vaccine, and after taking the second vaccine, you get a real good protection.
Okay, so a lot of people are diabetic, hypertensive, and they have allergic reactions to a lot of other products. Are they good candidates for vaccine? Because there's a lot of fear regarding taking a vaccine that they themselves might get COVID after taking the vaccine
So
because of low immunity?
yeah, so there is very, very little contraindications to not taking the vaccines. And definitely being a hypertensive, diabetic, kidney problem, liver problem, neurological problems, they are not contraindications for the vaccine. So anybody getting any of these problem, having any of this problem, BP, diabetes, heart problem, liver, kidney problems, etc., they can take the vaccine. In most cases, all the medicines that the person must be taking for the above conditions, none of them have to be stopped for the vaccination. Okay, whether they are blood thinners or whether they are taking aspirin or any other type of medication, they do not need to be stopped prior to the vaccination. That's very important to know. Some contraindications are there. One of them, if there is a known allergy to any of the components of the vaccine. For example, Covaxin has got aluminum hydroxide, so an allergy to that, and the Covishield has got an additives like histidine and EDTA, so maybe an allergy to that. So we really don't know whether anybody has got allergy to that. As a general thing, if anybody says that they've got a severe allergy or articarial problem, then if you declare that during while taking a vaccination, that would be like a relative contraindication, and they differ from giving you the vaccine. So any kind of severe allergy, there is a deferment of giving the vaccine. And personally, I have seen very, very rarely people getting some allergic rashes to this vaccine. And pregnancy is another place where you do not give vaccination, because nobody studies a pregnant lady, with drugs or any vaccine or anything. And that is why we do not know the effects of the vaccine on a fetus, on an unborn fetus. And that's why that can be a contraindication. There are no guidelines that you can give during pregnancy, and we generally avoid giving that. So apart from these very few contraindication, there is most of the people can and should take the vaccine.
Okay, so nowadays there's a talk about this cocktail vaccine or a booster dose. What is that?
So some people kind of feel that since one vaccine gives 70%, another gives 80%, some other might give 90%. Like for example, the American Pfizer BioNTech or the Moderna vaccine, they claim to have 92% efficacy. The Covishield claims to have around 70% efficacy. The Covaxin 80% efficacy. So some kind of thing is going on that why don't we mix these all vaccination and give it all together? So you can definitely not do that at the present stage, because each vaccine will carry with it some distinct risk of some complication. Okay, and if you are giving a cocktail, you are carrying a risk of multiple side effects of that vaccine. So unless we carry out a detailed study of such kind of a thing, you cannot really give a cocktail of a vaccine. The second thing is about booster dose. So nobody really knows what time frame we have to take a booster dose. For example, you take tetanus now, you have to take it once in 5 years or maybe more than that. So there is something called a booster dose. But about Covishield or Covaxin or COVID vaccines in general, nothing is known about the booster dose, because the illness itself is about 1.5 years old. So nobody can tell us, what's going to happen 2 years or 3 years down the line. But the take is that there could be a booster dose in the pipeline. Whether that would be in 1 year, 1.5, 2 years, we'll come to know. The medical community has to do a sound research on that and then find out if the booster dose will be required. That would depend upon the kind of immunity we developed after 1 or 1.5 or 2 years, and that would determine whether we would require a booster dose. So that's about it.
Okay, so what can we do as an individual to curtail this pandemic?
So as an individual, the best thing you can do is follow the norms. That is, keep physical distancing, use face mask, use sanitizers. Where it is needed, use gloves also. Try to be in a well ventilated room wherever you are. You just ensure that the room is well ventilated, because if the room is airy and well ventilated, the viral load or the concentration of virus definitely goes down. So that helps. And above all, the best thing that anybody can do is take the vaccine. Which vaccine to take? Whichever is available nearby, whichever is available first, just take it. don't look out for options, because all of them have, a good safety profile, and probably all of them have a good efficacy also. And the best thing that people can do is take the vaccine and also encourage others to take the vaccine. If all of us, if as an individual, the chances of my getting infected becomes less, I'm going to spread less. So that's the way that you can help. Take the vaccine, let there be less infection in you, so that you will not spread it to others, and spread the word, encourage others to take vaccine. That's the best thing that you can do as an individual to curtail and contain this pandemic. Thank you so much.
Thank you.
Hope you have enjoyed this video. Thank you very much.